Hi, everyone. I'm Tom Hanson. A new coronavirus strain in the United Kingdom is spreading international alarm. Health experts warn it may be more contagious than other variants, but assure there is no evidence the strain will worsen the severity of an infection. However, at least 30 countries are playing it safe. They've banned travel to and from the UK. The U.S. is not one of those countries, but there are growing calls for the U.S. to follow suit as the total number of cases nationwide nears 18 million. More than 318,000 Americans have died from the virus, and hospitals are nearing a breaking point, with more than 113,000 patients admitted. This comes as the U.S. begins employing its second vaccine. Moderna is rolling out 6 million doses. We're also learning who may be next in line to receive a shot. Meanwhile, on Capitol Hill, there are new developments on the $900 billion coronavirus relief package. We'll get to that in a minute. But first, here's Imtiaz Tyab in London.
If the goal was to contain the rapid spread of the new strain of coronavirus, then these travelers, crammed into one of London's train stations, desperate to get out of the city, wasn't helping. Britain has now ground to a halt just 2 days after it was revealed the variant of COVID-19 was spreading like wildfire. Hundreds of trucks at the busy Dover port now sit idle after France tightened its borders, raising real concerns over food shortages. The panic is now spreading across the globe, with more than 40 nations suspending flights from Britain, although not the U.S. So far, Americans can still travel from the UK to the United States without government restrictions. But with infections from the new strain of COVID-19 still shooting through the roof and huge chunks of England's southeast now under strict lockdown, it's an uphill battle. The new strain was first detected in September. It now accounts for nearly 2/3 of all new transmissions across the UK. Infectious disease experts say that's because it contains mutations, which make it up to 70% more infectious than other strains.
Although it's causing greater pressure in the community as a whole, we haven't got any evidence to suggest that it's making the individual sicker.
The World Health Organization insists the coronavirus is mutating at a much slower rate than seasonal influenza. But this latest crisis is like no other, and it's now up to the British government to find a way out of it. Imtiaz Tyab, CBS News, London.
I'm Mola Lenghi in Newark, New Jersey, where flights continue to arrive from London, leaving New York Governor Andrew Cuomo sounding the alarm.
This is another disaster waiting to happen. Why are we doing nothing?
We are in a particularly bad spot right now with cases.
Johns Hopkins epidemiologist Dr. Caitlin Rivers says it's too early to tell the impact of the new strain.
Right now, there's no evidence that this new variant will make our vaccine less effective or that it will make tests less effective. This is one thing that scientists will be keeping an extra careful look on, though, to see whether any adjustments need to be made.
Tonight, despite warnings by the CDC urging Americans to avoid travel, the nation's airports are now more crowded than any time since the pandemic began. The TSA screening more than 3 million passengers the past 3 days.
We're going to Orlando. We're going to spend Christmas in Disneyland. How fun is that?
Reality hit on this recent United Airlines flight from Orlando to Los Angeles. Video obtained by TMZ shows passengers performing CPR on a man who reportedly tested positive. The man later died. This was the scene today in Oregon as demonstrators tried to force their way into the state capitol as lawmakers met to discuss the pandemic. In California, where tonight hospitalizations have again hit an all-time high, you can hear the despair in this doctor's voice.
If you walk through my hospital, you would not feel like you're in the United States.
Amid so much misery, this is 65-year-old Philip Draper, released this weekend from a Kentucky hospital after 21 days on maximum oxygen support. The human touch, so rare in this pandemic, on full display.
Oh, I love you.
And then, the most welcome words of all.
Let's get you home.
Millions of doses of Moderna's coronavirus vaccine are on their way to thousands of sites across the U.S. It comes as the CDC panel gives its recommendation for who should be next in line for vaccinations. Errol Barnett has those details.
Tonight, the country's second COVID-19 vaccine is arriving at hospitals nationwide. At this VA facility in Boston, it was a dose of hope for military veteran Patricia Thomas.
It's a little scary, but I'm glad to get it over with.
Moderna's nearly 6 million doses follows Pfizer's almost 3 million distributed in the past week, both of them initial rounds.
This first wave of Moderna shipments will be sent to more than 3,500 sites, a greater number than the Pfizer vaccine was sent to.
Also, the Centers for Disease Control is now recommending who's next in line for the vaccine. Frontline essential workers like first responders and teachers, as well as people 75 and older. Already, 500,000 Americans have received the Pfizer vaccine. This afternoon, President-elect Joe Biden was vaccinated near his Wilmington, Delaware home on live television.
I'm doing this to demonstrate that people should be prepared when it's available to take the vaccine.
Vaccine reinforcements cannot come soon enough from states like Tennessee, where the infection rate is now among the highest in the country. And the governor here in Tennessee says vaccines will help end the war against this virus. Also, Monday night, word from the National Institutes of Health that Dr. Anthony Fauci, HHS Secretary Alex Azar, and others will receive the Moderna vaccine on camera Tuesday morning. The hope, Tom, is that seeing this will help boost confidence that these vaccines are in fact safe.
Errol Barnett, thank you. And for more, let's bring in Dr. Dara Kass. She's an ER doctor and a medical contributor for Yahoo News. Dr. Kass, thank you so much for joining us. As we saw, Moderna began distribution of its vaccine here in the U.S. Monday. So what are you looking out for? Could we see similar side effects or reactions as we saw with the Pfizer's vaccine?
Yeah, I think that we're going to be expecting similar side effects. The technology between the two vaccines is very, very similar. Remember, we saw very, very few side effects, certainly very few serious side effects with the delivery of the first tranche of the Pfizer vaccine. And so we will deliver them slowly. We will watch patients afterwards, and we will document all the results so we make sure that we know what to tell the general population when it's their turn to get vaccinated.
Now, a CDC advisory panel met Sunday to discuss who should be next in line for a vaccine. I actually did a New York Times quiz where I think I was like 200 millionth in line. What did they decide, and when might these groups actually get vaccinated?
So they're really trying to risk stratify patients to see who's going to be at risk of getting sick or dying from this virus first. So they really risk stratified to patients that were exposed, obviously frontline healthcare workers, because we need them to take care of patients. And then those in the next tranche are patients who are high risk for death or dying, so those over the age of 75 to start. And then those exposed to the virus a long time, people like frontline workers that are not only hospital workers, but first responders, teachers, food and agriculture workers, people in manufacturing sites. And then that actually will get to about 87 million more people. So we're looking at about 100 million to 150 million people by the time everyone's 65 and older and essential is actually vaccinated. That's a lot of people, but we're certainly not at herd immunity at that point. And that's when people like you, younger than 65, no prevailing medical conditions, will actually probably get vaccinated between the second quarter and the third quarter, maybe even the fourth of next year.
So we have these vaccines, this positive news coming out. We also have this variant of the coronavirus. Former FDA Commissioner Scott Gottlieb said that the new coronavirus strain spreading in the United Kingdom is, quote, probably not more lethal. So why is it so concerning, and is there major cause for alarm here?
So it's concerning. I wouldn't call it so concerning. The issue here is that it looks like it's more contagious than the current version that we have in America. And remember, there have been lots of strains floating around this entire time. It's why we've asked people to stay close to their home, because those are the strains that we're dealing with. But as this virus is more contagious, it means that more people are going to get sick. And in fact, it's going to put a strain on our testing programs and on our hospital evaluation systems. Even if people don't need to be hospitalized or pass away, we're still going to see an increase in burden on our healthcare system.
Do you think that we should be restricting travel between the UK and the US?
I do. I think that we should be restricting travel between most major metropolitan areas as we start to realize that we need to keep people contained. I certainly think that what Governor Cuomo did today, asking for a PCR validity that somebody is negative before they come to New York, is a step in the right direction. I just think that we're going to have to be extra vigilant over the next few months as our vaccine compliance goes up. We need to get that viral load down.
And we certainly don't know if this variant strain is already here in the U.S. You know, the big question remains, what does this mean for the vaccines that are already available for some Americans?
So it looks like that's not an issue at all. When this vaccine was tested, both of these vaccines, but all of the ones that are currently under consideration, they were actually tested in their phase 1, phase 2 against multiple strains of this virus. So it is not concerning to anybody right now that this new variant has any effect on the vaccination process. So that's very, very good news.
So another big headline, obviously, is holiday travel. Millions of Americans are already traveling ahead of the Christmas holiday, despite warnings from health experts. Remind us, what are the biggest risks to traveling right now, and how do people stay safe if they do, in fact, decide to travel and defy those CDC, the CDC guidance?
So my compromise with certain people is if you're going to travel over the holiday season, you get to travel once and you have to quarantine before you leave and then quarantine when you get back. So it's a pretty difficult timeline, but you spend 10 days, isolated, you make sure you're tested negative, and then you can go somewhere, be there for an extended period of time, and then isolate yourself when you come back. We really don't want people traveling, not just because of the risk of bringing the virus to where they're going and traveling infected, but also in catching the virus where they are and then bringing it back to where they live. And again, this is concerning for people that are traveling maybe to the Caribbean islands or other places where you might have European travelers, and that's another way that we can have an intermediary mix of this virus, which is what we saw happen in New York in the spring.
Yeah, I'm pretty sure that most Americans are probably not adhering to the quarantine that you're suggesting, Dr. Dara Kass. Thank you very much.
No problem.